Yeah.
Hi, how are you doing? We're here today with the new dress mode. My wife insists that I wear these wonderful gloves when I'm out of the house, and then, like all good folk, dispose of them on returning in hand wash. So we are in quite a critical phase of this virus, leading to, for some people, quite a serious illness, COVID-19. And it's a broad, continually moving story, pretty much all over Europe. But one thing I found in the Times last week was a comparison of who's got what around Europe and what state they could be in to actually fight this disease, illness, whatever it's called, that will be inflicting many of us certainly within the next couple of weeks, if you're in London or Birmingham, and then it will be spreading out and it will spread through the country. And the government has now decided that vulnerable people, those over 30, those who've got pre-existing conditions, should be looking to isolate themselves from the community for, I believe, the next 12 weeks. That's what, 84 days. And it's hoped that thereafter they may be on top of it. But let me tell you or share with you what the United Kingdom has compared to many European countries, what it has with regards to critical care beds. It actually has 6.6 care beds for every 100,000 people. It is way below the European average, which is 12. And then we move from that to actual hospital beds, and the UK has 228 beds per 100,000 folk, whereas the European average is nearly 400. And then, and this is very important to us, certainly living on the coast where we have been having difficulty in attracting and retaining GPs, doctors, etc. The UK has 68 and the European average is 92. But when we look at, say, Germany, who currently looks to be performing, or its medical services are performing very well considering the mortality rate with the number of folk that are being infected. Germany actually has nearly 30 critical beds. It has nearly 620 beds in their hospitals, and equally, and probably more important, it has 69 doctors per 100,000 residents. So really the resources that you have will determine very much how effective our medical services can be in fighting this. And we have been very fortunate in that we have time, and we've had time, to reposition our hospitals and the staff and plan, as we should have already planned, for what will happen when this particular virus hits its peak with regards to hospitalisation, and how those who will be seriously ill patients can be best recovered and made safe. I am deeply concerned that the messaging that we've received in this country has been rather weak, a bit bumbling, and fundamentally it's very serious. And if we look at a chart that shows the spread and the growth within Italy, particularly northern Italy, you can see how easy it is for the local health services to be overwhelmed. We are expecting, are we not, that London and Birmingham will be the two cities who get the biggest hit first, but then it will spread out to us on the coast. So with those figures in mind, and Bernard will incorporate them in this video when he puts it out air, you need to reflect that it's in all of our hands to do the best we can to ensure that the relatively limited medical services that we actually have are able to do the best they can. And to do that, you really need to stay safe, and really, where you've been told, stay at home.